uh, to the African American community. And today, our guest, Dr. Adam Sumlin, we're going to discuss Black men's health, particularly prostate. Uh, Peace be with you. Thank you, Dr. Sumlin. How you doing today?
Good. Can you? Thank you for having me on.
I appreciate it. Can you tell us a little bit about yourself, Dr. Sumlin? You are currently in Buffalo, New York, right?
That's correct. I'm in Buffalo. I'm at Roswell Park uh, Comprehensive Cancer Center. I'm
Okay.
also at the VA. My specialty, I'm an assistant professor of oncology. My specialty is in prostate cancer. I've been at Roswell for 38 years.
Wow.
Um,
Awesome.
I got into prior to doing prostate cancer, I did photodynamic therapy, which was treating cancer patients with laser and a photosensitizer. I did that for about 26 years, and then I
Wow.
started moving towards prostate cancer and to develop new screening tests for prostate cancer and also develop new treatments for prostate cancer. And at present, I am in the process of developing a new screening test
Okay.
using urine, which no one else has used, but I am looking at the biomarkers that are related and connected to prostate cancer that can be used in urine so that men don't have to worry about the digital rectal exam
Right.
or
Right.
getting the blood anymore.
Awesome. Awesome. Well, first of all, for the some of the listeners might be coming up, what is the prostate? What exactly is that?
The prostate actually is a walnut-sized shaped gland that actually produces the semen,
Oh, okay.
and it works with the reproductive system of men. So it produces the semen, and normally your prostate will get larger as you age.
Okay.
So in African American men, you've always being told that you have an enlarged prostate or your prostate is oversized, but that's as long as it's not um, cancerous or have any cancerous material, it's fine. Prostate
Okay.
and over enlarged prostate is causes you to urinate a lot, but
Uh-huh.
that's about it.
Okay. Because I know there's people. I mean, some people, my associates and friends, associates, were concerned about it. I mean, it was enlarged. I guess their prostate was enlarged to the point where they had to frequently urinate at night,
Right.
and they were taking. So besides, like I guess any surgery and thing, is it anything health wise you could do to reduce that?
Well, basically, there's some tablets that people take to
Okay.
reduce. What it does is slows you down from your urination at night. So if you're urinating 4 times, 5 times
Yeah.
at night, it'll cut you down to 2 or
Okay.
maybe 3. The problem is that with an enlarged prostate, because your prostate where it sits between the rectum and the bladder. The
Mhm.
bladder presses up against the prostate, so that causes you to go and with an enlarged prostate, it pushes up. That causes you to go to the bathroom a lot. But
Okay.
it's basically what you want to do is at night cut down on what you're drinking,
Ah, of course, of course.
and that will keep you from going as much.
What about the saw palmetto? I've heard about people using it. I haven't used it myself, but I heard about saw palmetto. Is that
Yeah,
like a
salt
herb?
palmetto is a herb, and there's a lot of herbs that's out there. You had cat's claw, you had turmeric,
I'll take
salt
turmeric.
palmetto. These are just different herbs, and I don't disclaim any herbs. I won't tell you that they don't work, and I won't uh, say that they do work. The problem with all supplements is that they work differently for everyone. And
Okay.
in order to say that, like salt pomelo is one of those that, again, it's supposed to decrease the size and have you do less urination. However, in order to be convincing of that, you would have to do a study where you have 100 men with the exact same disease, 50 of them on the supplement, 50 of them not, and then see what data you get from it. And from what we have done so far, we see that there's no decisive way to say that. Yes, it works. no, it doesn't work. Because some of them it works, some of them it doesn't work for.
Wow. Okay.
So it depends on the body.
I see. Okay.
It's the same
Now,
with vitamins.
same with what?
With vitamins.
Oh, okay. 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 Now, myself, I was told I had prostate cancer, and so I had a biopsy. But I was reading something about it. It said to keep it from reoccurring is just to exercise, exercise regularly. I mean, is that something you recommend, or does it make a difference? Or
Well, you had a biopsy, but
right.
with the biopsy, what was your Gleason score?
But what they told me was I had to do some treatment, so I had some radiation.
All right.
And
So
that took care of it. I did it like over about 6-8 week period.
that's right.
And,
You had probably either a 28-day or 42-day treatment of radiation.
42.
Where you go 5 days a week and you get
Exactly. Woo.
5 to 10 minutes of treatment. Then you go and do what you want to do.
Right.
The point with that's a very good treatment because of the fact that what happens with that is that the cells are killed off. And if that disease did come back, it's going to come back in 25 to 30 years.
Oh, okay.
And at
That's
that point in time,
okay.
based on your age, nothing is going to be done. So at that point, you'll be going into active surveillance and you will not die from prostate cancer because it's a slow growing disease. You will die from something else before you die from prostate cancer.
Wow. Well, that's a comfort. Nobody told me. I mean, my urologist guy didn't tell me that. So that's actually a comfort.
Yeah, there's several types of treatments for prostate cancer. And right now, I always tell everybody, get a second opinion. Radiation is one of the first that I always tell people to do based on your age. Now, if you were 45, 50 years old, at that point, I would probably say to you, you would have to have a radical prostatectomy.
Okay.
Because of the fact that if it comes back, if you did radiation at that age, at 45, it'll be back at 65, 70.
Okay.
And then, you don't want, if it did come back, but you are 100% correct on doing exercise, and also your diet, your nutrition is very important. With African-American men, one of the problems that we have is we eat a lot of fatty foods.
Mm-hmm.
Eat a lot of food on the run. We eat a lot of fried foods. And with that there feeds the cancer.
Fried food.
But what you want to do, you moderate what you eat. Okay, you want to have your fried chicken, or you want to have, your ribs, but you eat it in moderation.
Okay.
You don't have to eat this every day. You don't have to eat it every month. You can eat it at once every 2 months. It doesn't matter.
Okay.
You should have a lot of fruits, vegetables in your diet.
Okay. I'm glad you said that because I have two of my brother-in-laws, a little bit younger than me. They had it. They had the radiation too, but we don't want to talk about it. They probably listen to this, but they probably need to moderate their diet. We'll put it that way. I'm glad you said that, especially the fried food. I know one of them eats fried food. I know I've seen him eat fried foods. So
we all do.
Yeah, but I'm just gonna mention it to him. Just trying to look out. But that was some excellent information. I mean, just right there, because a lot of us don't have enough fruit and vegetables. I eat my diet. I have fruit daily. I mean, every day.
And that's a good thing.
That's all I do every. But I'm gonna start recommending it. Because I have somebody that might come on. The call hasn't come on yet. He just doesn't want to know anything about prostate. I mean, it's kind of, I think maybe he's just scared of that. He didn't like that examination.
Well,
the finger examination. I forgot.
Exactly. And to be very honest with you, most African-American men are afraid to hear prostate cancer.
Right.
Once you say to them that it affects their sex life, they don't want to hear nothing else about it. So they stay away from it. And that's one of the reasons that I got into it. The Department of Health has given me a $650,000 grant
Awesome.
to teach and educate African men on prostate cancer here in
Awesome.
Erie County. And the reason for that is that African American men stay away from it. The reason that we have a high risk of prostate cancer uh, is because of the fact that, and I'm not saying that we're not smart enough. The knowledge part of it, we're not strong on. And the knowledge part of it is this: if just like you, when they said that you had to have a biopsy, well, they might have told you that your PSA levels was elevated.
Exactly. That's 6.5.
However,
Right.
when they told you your PSA levels was elevated, did anyone say to you, what did you do 72 hours prior to this PSA test?
Nope.
All right.
No.
Here's the thing. If you have sex, if you ride a bike, if you do strenuous exercise, your PSA levels will be elevated.
Wow. That's
If
what
you
I
do
did.
this 72 hours before the test is done, it means you got an elevated PSA level. Now, if I check your PSA level at that time and I see that your PSA level is 7, 8, 9, I'm going to say you need a biopsy.
Okay.
So now you're going to get a biopsy. But guess what? If that biopsy comes back and it was all negative, you happy that it's negative. However, on the downside of that, you didn't have to have that biopsy.
See? See? Right.
All
Right.
right. So the question should be asked.
They
Are
never
you,
asked me.
and if they don't, that's why I'm saying knowledge for African American men. Then you need to know, say, hey, wait a minute. What if I did A, B, C, and D prior to this? Will that affect my PSA? You have to have
Wow.
that. So if you can say that, now you put yourself at a different level.
Okay.
Then you know not to do it. And not only that, if your urologist or your primary say to you, I'm going to do a DRE, and he does a DRE and says, oh, I feel your prostate and your prostate feels enlarged, or I feel like a little nodule on your prostate.
Mhm.
I want to do biopsy. At that point, you should say, I want you to do an MRI.
Okay.
Because the MRI will take the picture of the prostate, and now they can see directly where the nodule is or where the abnormality is. And at that point, you do the biopsy, do an MRI biopsy, then it goes directly to the site. Normal biopsies takes the snips all the way around, 16 snips
Oh
all
yeah,
the way around.
I had about 12 of them. Woo! It was
All right.
covered.
However, if you do an MRI biopsy, it's only going to take the snips where it sees the abnormality, not all around. So now you know that if this goes to pathology and they say yes, it's negative, they can tell you exactly what it is, what type of carcinoma it is, if it's just a lesion, it all can be done just based on that. But you don't do the random snips. The random snips, you can miss the sites.
Wow.
So that's why
Wow.
you do an MRI biopsy. And with that, this again is knowledge that is being given to African American men so that they know what to ask for. So what by
Wow.
us not doing it and with the fear of saying that it affects my sex life, don't bother me till it's not working. Well, it's too late
Yeah.
because at that point, you're going to be at stage 4. And once you get to stage 4 of prostate cancer, it's the first place that prostate cancer metastasizes to is to the bone.
Mm,
When it gets to the bone, it becomes lethal.
mm.
That's why people die from prostate cancer because it got to the bone. If you catch it
What might be
early,
the
prostate
warning
cancer.
sign?
Excuse me.
What are there any previous warning signs for
That's
something like that?
that's one of the problems with prostate cancer. You can see that you're going to be urinating a lot. You don't feel any different, except for you have a lot of urination, or you will see blood in your urine.
Mm.
You'll see blood in your semen. But prior to that, I tell everyone you should be screened for prostate cancer at least once a year.
Okay.
You should
And that
definitely get screened.
and that's by the
And that will be by the DRE. They love to give you the PSA,
Right.
Right.
PSA is not a indicator, but PSA is a monitor.
Okay.
It monitors. So yes, PSA was developed at Roswell Park. I was actually on the team with
Oh,
Dr. Chu.
really?
Yes, Dr.
Okay.
Chu developed the PSA test. I was on the team with them. And the issue there is PSA tells you the specific antigen that's in the prostate that gets elevated. However, that antigen can be elevated, as I said earlier, with strenuous exercise. So it's not indicating that you have prostate cancer.
Wow.
It monitors it. Now, yes, if your PSA level on a continuous basis is greater than 4 and it's starting to
Okay.
go up,
Okay.
if it starts to go up, now you say, okay, yeah, my PSA was 4.5, now it's 6.2. At that point, now you should be, let me get DRE, let me get an MRI, let me see if I do have prostate cancer.
Now, because I've never heard of the DNR,
The DRE,
DRE.
DRE. Yeah.
yeah, I'm sure you did. It's called digital rectal exam. That's where they stick the finger, use the finger.
Oh.
I'm sure you heard of it.
Yes, you have.
Yeah. Well, sometimes my doctor suggests that I get instead of the finger, I get what when they look for a baby, what do they call that? When they
Ultrasound?
Ultrasound?
ultrasound, yeah.
Ultrasound is not going to,
I mean, tell you if your prostate is somewhat swollen.
it'll tell you that it's enlarged, but you can feel it until it's enlarged.
With the
Okay.
finger.
Yes.
Yeah.
That's the problem. Most men do not like the DRE. Most men just I'd rather do without it, so they ignore the screening. That's
Yeah.
one of the reasons why I start looking in the mutations that are in urine that's related to prostate cancer, so that if we get the proper synthesis done with the biomarkers that I'm looking at and the genes that's in them, BRCA3, BRCA1. These genes are not only are they effective with breast cancer, but they are present in the prostate. If that can be isolated, then I can use the urine and say, okay, hey, this person has had stage 1, stage 2, stage 3 based on these genes in urine.
I thought I read an article recently about a new prostate testing format. I'm not sure if it was, I'm thinking it was that from your urine that you can
No, well, it's not out yet.
Okay.
Basically, the new thing came out now is therapy. Immunotherapy is another treatment for prostate cancer.
Okay.
So that just came recently, and that's what
right.
people are looking at. And it's some
But
more.
that's after the fact. It's not the detection. It's
No, that's not detection. That's after,
right.
because right now everybody is relying on the PSA and the DRE.
Mhm.
And more people are using the PSA because of the fact that it's easier. Take the blood sample and run the blood through it. And basically most physicians are saying, well, we'll just use the PSA because the men hate
Right.
DRE. And believe it or not, physicians don't like doing the DRE. I mean, it's one of those that it is
Okay.
the
Okay.
best one there, but it's the best one to be done, but it's not comfortable for both parties.
Now, anything
Okay.
that actually works on the prostate, it was a drink. I don't know if it was PHT, FHT, or something to do with your the lack of testosterone in your system, or
There's
as
a
you
lot.
get older, that go
There's
ahead.
a lot of things out there that people take to help with the prostate. I mean, green tea. Green tea was one that officially was there. And again, like I said, it works for some, it doesn't work for all.
Right.
So you have to, if something you take, I have a friend of mine right now who refuses to be screened for prostate cancer,
I had
but
somebody
says
like
that cat's claw works for him. And that's what, so he would get a PSA done based on
Uh-huh.
his cat. And if they tell him that his PSA is 5, he'll start taking more cat's claw instead of doing anything else.
Right.
Wow.
All right. So and he feels comfortable that it works for him.
Right.
But
But it's
another,
always up to the individual.
that's correct. Another person came and said that turmeric worked for him, but cat's claw didn't work for him. Green tea didn't work for him. And then he said turmeric stopped working.
I mean, in a lot of cases, it's psychological, right?
That's right. It's
You
in your
believe what
head.
you believe.
It's exactly right. And that's why any of the supplements, that's what, even if you read any of those that you're talking about, and you read, if you read the information behind it, it will say, we do not say that it cures cancer.
Okay.
It will say that. So
Wow.
that tells you there, that, well, you might feel that way. We say that it's a supplement that helps with your diet and it can do some of these things, but we're not going to document that it does.
Now, is it any different between the men in America and other men around the world as far as the prostate goes?
But not really, because the data that shows that 99% of all men is going to end up with prostate cancer.
Wow. Wow.
All right. So that's not separating anybody out. But I can say, and based on some of the research that I've done, it showed, like they used to say, what got me into it is they used to say that African American men had the highest prevalence of prostate cancer. And I kept asking the question, why? And they said, well, it could be genetics, it could be nutrition, and it was going here and there. So I said, okay, let me see if it's genetics. First thing I said, let me see if it's nutritional.
Right.
So I said, I took 500 men from a urban setting and 500 men from a rural setting, because urban men eat a lot of fast food, they eat on the go, they eat a lot of fatty foods.
Okay.
Rural men grow their own food and it's all freshly done. Well, when I did the study, it showed urban African American men, Caucasian, urban, rural African American, rural Caucasian. When I put the data together, it said African American men, urban, Caucasian men, rural. African American men, rural, Caucasian men, urban. That showed right there that it was not nutrition.
Oh.
Because if it was nutrition, it should have been African American men, urban, Caucasian men, urban. However, Caucasian men rule came right after African men, urban.
Really?
Right. So that meant that the Caucasians in the rural area was eating something different. It wasn't nutrition. So after that study, I started looking at genetics. See, and what it showed me there was, they say, if your brother have it, your father have it, your grandfather have it, you're going to get it. Well, that came about because of the fact that the family history all came about because of the fact that, yeah, with prostate cancer, it tends to, all men is really going to get it. However, we started looking at genetics and we looked at 25 families. Out of 25 families, grandfather had it, but nobody else. Father had it, nobody else. And a couple families, the father and the brother, father and the son had it, but his father didn't have it. And if it's really going to go genetics, it's going to continue down the tree. And so what we figured out is that genetics, nutrition, diet, they're all risk factors, but not the prominent risk factor. And what we did find out, and that's what I said when I finished the study, that's when I found out that the most prominent thing that was affecting African American men with prostate cancer was knowledge. You stayed away from knowing what to do, how to do it, when to do it.
Right.
And you ran from once someone told you you had prostate cancer, you went into a corner and said, leave me alone. I'm doing everything that I'm going to be doing. And then when it gets worse, now you can do that. I had a patient come to me and say, basically, and his wife was with him, said, instead of looking at this here, you should make a different, stronger Viagra for me. And I said, you're telling me that you rather have Viagra, you rather have your sex life than to be treated for prostate? He said, yes. I said, so you would rather just have a sex life and leave your wife? He said, my sex life is more important.
Wow.
Yeah.
All right.
Important in his life. Huh?
There you go.
Wow.
So that tells you what a lot of African American men think about.
Yeah.
And he was like, okay. So I said, well, you can't do that. His wife laughed it off and she said, but he's sleeping on the couch tonight. Okay. Well, so you think about it, where is our mindset?
Yes.
And that's why I tell everyone when I give talks, or I tell you, bring your wife, girlfriend, better half, because they hear where we don't. Once we hear what it does, we turn it off.
Yeah. Well, sometimes that wife will keep you alive in the long run.
She gonna say, wait a minute, what can be done? How do we do it? What do we have to do? Where we go next?
Mm-hmm.
We're not gonna ask those questions. We're gonna say, okay, yeah, well, it's gonna do this. No, well, I don't want to hear about that. Yeah, you could talk about something else right now. I don't need to hear that. And that's
that pretty much comes with every black man and whatever disease he might be facing.
That's correct.
Yeah.
That's correct. So that's why I said the most important thing is the knowledge.
Right.
If we have the knowledge and we know, hey, this is what it's going to do, this is what we need to do, and this is how we're going to do it, we'll be better off.
Yeah. Well, a lot of times it's talking amongst ourselves, about
exactly
our
right.
own ailments, which a certain the group, like Mr. Walker and other people, we always talk about our problems that we might be having, physically,
And that's
Right.
a good thing, and that's what we try to do. We try to get African American men always get into support groups after the fact.
Mm.
Because of the fact that we have an embarrassment. I don't want nobody to know that I got prostate cancer. I'm healthy. I'm a man. I'm it. You can't tell me that I'm not healthy. We shy away from that when we should be discussing it, because what we're discussing is not only going to help us, it's going to help the next man that's right next to us.
Right.
Mhm.
And that's what we should be doing.
Right. Exactly. But in one case, I mean, not just to be argumentative, but a friend of mine, well, associate of mine, a little older than me, a couple years older than me, it's about like 4 or 5 years ago. Anyway, he found out that he has some elevated levels. I don't know if he had a biopsy or not, but his wife she's a nurse or a retired nurse, and she told him, because he asked me about it. I said, the treatment, I take the radiation, and she went with like removing the prostate. I mean, just he's still a couple years old. She said, and she said, yeah, they got it all, but the flip side of that is now he's on a diaper, very, 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 very uncomfortable. I mean, like he said, if he cough, very uncomfortable. So I mean, saying his wife, she kind of like alarm. He might, in other words, he might have just went by himself because his wife said, "Oh, it's cancer there. Take it out." And now, and he tells his other friend, he wish he had listened to me.
Well, here's the thing.
I suggested radiation personally.
Here's the thing. The wife probably said do a radical prostatectomy because the wife probably talked to, and it, like I said, it depends on the urologist that you talk to. All right, like I said, I'm an assistant professor of oncology. An oncologist is not going to lead you to surgery.
Okay, right.
But if I'm a urologist that do surgery, I'm only going to talk to you about surgery,
Right.
not about any other treatment for the prostate.
Right.
So it depends on who that wife was a nurse with.
Yeah, I guess.
All right. But the thing is that I always say, like I said, I tell you to get a second opinion because of the fact that immunotherapy might be better for you than radiation. Hormonal therapy might be better than you than radiation and immunotherapy. Radiation might be best for you over all of them.
Mm-hmm.
But based on your age, you might have to have a radical. The problem that I have with a radical is this. They'll tell everybody will tell you that they'll do a radical prostatectomy, they'll remove it, you're gonna be fine, and you're gonna have everything gonna be the same as it was, but not as aggressive as it was. So in other words, you might be able to have a ejaculation, you might have a hard penis, but it's not gonna be like it was. Well, the point to the matter is that that's not true. Okay. Because once the nerve is removed, and what they always say is we want to try to save the nerve so that you can have those sensations.
Okay.
But if you save the nerve and you leave some of the cancer cells, guess what?
Wow.
It's going to continue to grow.
Wow.
So having a radical prostatectomy means you got to take everything and you're not going to have those sensations.
Right.
And that's why men get, I don't want to know nothing about it.
Yeah.
So I was talking to a friend yesterday. He just informed me that he had his prostate removed.
Mm-hmm.
So what are the ramifications, physically after you have that done?
You might have to wear, as you said, Depends or some type of diaper. You're going to have leakage. You're going to have
it affects your bladder too?
Well, it doesn't. If your bladder is there, it doesn't really affect your bladder, but your bladder swells, and therefore you gotta go. You just can't hold it. You don't. The muscles that you have that you can hold until you get to the bathroom,
right?
They're partially taken out.
Wow.
So you might go and not even know ahead of time.
You can't. You know you're getting ready to go, but you can't stop it.
Right. Oh, okay.
So it's coming out. And what are you going to do? So you got to wear Depends.
Mm.
And that's the problem when you get a radical prostatectomy. There's a lot that goes into it.
Mm-hmm.
But you have the thing about it is the good side of it is you're cancer free.
Right.
That's the good side.
That's what his wife said, but he's
you're cancer free, but you don't have the same manhood that you want because
all the sensation is gone.
That's right.
Wow.
So that's why I said there's so many different types of treatment. You do what's better for you based on age. Now, based on his age, his wife probably said, "Well, we're not gonna have no more kids, and so it doesn't matter."
You ain't got
all right,
right.
Take it all out. Right. He could have done it for that reason.
Yeah.
You don't know.
Yeah. I read something, just offhand that if you masturbate, like 21 times a month, that it'll keep prostate,
I don't know where you read that at. But
come on, man. Come on.
That's a self pleasure. That's what that is.
And it'll regulate, keep your prostate from swelling.
Nah, your prostate is the semen. That's what it produced. Masturbating is just releasing the semen. How's that helping your prostate?
Right.
Well, relief, keeping it down.
Well, the point is that
your exercise, bro.
There you go. Do the exercise because your prostate is not going to be ready to produce semen until you are hard.
Right.
Right.
And then
Oh,
it's ready
okay.
to
I
produce
didn't.
the
I didn't
semen
know that.
and
I
let the
didn't
semen
know
out. So
Duh.
you're making yourself, you're satisfying yourself is what you're doing.
So you learn something new after 70 years, you know.
But I feel a little bit shortchanged because when I started having my PSA go up, doctor, I was riding my bike about 5-6 times a week. I mean, a couple of times I would in the summer I would ride every day, daily. I mean, and I ride for about I'll go about 10 miles, maybe an hour. Sometimes I got it down to like under an hour, 55 minutes, and it's just to, just to be doing it. But if
Right.
I had known, because what happened in my case was just a standard PSA, and doctor said it went up from 4 to 5. He said, "Oh, you gotta have a biopsy. Gotta do the biopsy." That's what he said. Okay, man, biopsy was really the recovery is very painful. So he took about I guess 12 random, and it's only like about 3 that might have had some cancer cells. So I talked to another doctor because he wanted to just go straight to the radiation. And I said, our doctor said, nah. He said, the other doctor said, no, that's not no reason to go. He said, because he said I actually had a small sample. He said he considered that was small. So he said, wait, my sons, heard about it. I told my wife I was going to wait. They were all upset. Well, one son, he said he's having a headache. Dad, you got to do it. So then I went back to, this is the second doctor said, hold up, wait a minute. I didn't know about the bike stuff because I was right. I was riding all the time. All I do was right. So anyway, I went back. It went from like 5, went up to 6.5. So he said, yeah, you got to do something. And he said, well, if you do the radical, you ain't got to worry about it no more, about coming back. But I said, nah. This was like 5 years ago. So I said, actually it was 6 years ago. I said, nah, I'm going to do the radiation. But if I had known about the bike, I was, especially in the summer.
You're right.
I go at least 5 times a day, 5 times. Only time I would ride was just for rain. If it rained, But other than that, but if I had known that, so I'm thinking like I was elevating my PSA.
You
All
was,
through,
and therefore,
all through the picture. So I might
exactly.
not, because the doctor first said that out of the 12, it was like a small sample size. He was saying that's not, but if I had known I was elevating the PSA, I took off for about a week, then had it checked.
That's what
And
should have happened.
I
And
mean,
that's what,
I didn't know about I was elevating it.
that's right. And that's why I said that's this part. This is some of the stuff that I do right now. I go out, I educate, and I say these are the things you look for. I have a whole list that I tell you, here's the different type of treatments, here's the things that you look for, here's the reason why you do it. And then you at least know when you step in there, all right, yeah, I was with my wife last night. So if he asked me to do a PSA, I'm not gonna do it. I'm gonna tell him let's wait a couple days.
Right. Yeah. I see. And same here. I didn't. It's a little. It's the, like I said, it's the little things.
It's right.
But when you don't know have the knowledge, like you said, I'm thinking since you said that, I might not have had done anything. I mean, because I
You
didn't have
probably would
any.
have.
I
You would
didn't
have
have
been an
any
active
issue.
surveillance.
Yeah,
That's exactly what would
I
have
didn't have. But one of a barber in my barber shop was now he was younger than me, and his PSA start going up a lot. So it could have been into his diet. And it could have been, whatever. I don't know exactly what he's eating, but he claimed he's eating healthy. But he said he started going up. He's younger than me, and he went ahead and had the radiation.
hmm
Because but one thing. But since I had the radiation ended the end of 2018. But since then, my PSA level, I've checked it recently. I mean, it's always been like at 1 point something. It has not gone. It's not gonna. I mean, even though I ride, I don't ride every day anymore. But even though when I ride, and I've been checking it after I ride or whatever, and it still hasn't. It's always at 1.0, or in
Right.
fact, at one time it was under one. It was under one.
Yeah, exactly. It would be 0.2, 0.8.
Exactly. That's where
That's
I'm
where
at.
it would be, no question. And once it starts rising, that's when you see something is happening and you think what it is, but you have to ask the questions because if you riding your bike and it goes up to 1.2 or 1.3, so what?
Right. Yeah. That's the high. I think the highest has been is 1.2.
Yeah.
So maybe I don't know. maybe it helped. Maybe I don't know, but it has not risen above 1.2. I think
No, that's
another.
where it's going to be. But
Yeah.
riding the bike is what causes the rise to that level. Then it just stay. It's your PSA is probably, without riding your bike, is probably around 0.3, 0.4.
It's been that low during the winter because I don't ride as much in the
Right.
winter.
But then that's what it is. So when you ride your bike, that's what increases it.
Wow. But I mean, I guess
Dr.
that's good
Sumlin,
news.
Yes, sir.
do you find that it might that there might be a lack of empathy for Black males in amongst your profession?
Yes, I do. I do. And I think the reason being there is because of the fact that most Black men now are saying, I want to go to someone who looks like me, because they're going to tell me what I will believe them more than I will believe their counterparts.
No doubt.
And the issue that I have seen, and that's why I start doing exactly what I do, is reaching out to talk to us, is because of the fact that when you go to our counterparts, their interest is basically in how they're going to get paid.
Wow.
And basically, I don't have the time to go through everything for you. So you coming in and you telling me that you got a headache. Well, okay, I'm gonna give you some aspirin and you can go.
Wow.
I'm not gonna ask you how it derived, how long it's been going on. I don't have the concern of what's really going on with you.
Right.
And that's where the issue come in at. It's very sad to say that right now that insurance pushes the medical field.
Well, here this soup. Oh, I don't care. I'll take a little bit.
Wow.
So that's what insurance really pushes the medical field. If your insurance say I'm not going to cover it, then I'm not going to tell you to do this. I mean, I'll give you a good example is there's an eye doctor who was saying that you can have Lumigan and Comigan for your eye drops for anybody who has glaucoma.
Wow.
All right.
Wow.
He's gonna say, well, I'm gonna send it to your pharmacy, and you're gonna have to get no generic brand. Well, you go do that. The Comigan cost you $110. Insurance not gonna pay for it.
Wow.
Lumigan costs you $55. Insurance is not gonna pay for it. Now, if you get the generic brand of Comigan, it's $5. If you don't have this information, you don't know what to do with it. You're just going to take what is given to you. So, and that's the sad part. So that's where we need to really ask questions. I don't care. Every question you ask is a good question. There's no question that is people say, oh, that's a dumb question. No question is a dumb question. Because if you don't ask the question, then you don't get the right answers that you need. And when you to our counterparts, you don't ask questions. You take what they say as gospel.
And I hate to say, but that's why I always try to find a Black doctor. I've been with the same doctor for 23 years. Sometimes they'll say, because I don't like to take pharmaceuticals, but only when I need it, but he'll suggest a natural remedy that might work too,
That's right.
And usually and this is with all his patients, usually when he sits down with them, he spends time with everybody,
Right. That's the difference. That's what I'm saying. But you got some places that say you have to see 75, 80 patients in a day. And that's kind of impossible.
Right.
But in order to meet your contract or to meet the criteria set for that hospital or that clinic, you have to see 75 patients in a day. Well, if that's the case, I'm working an 8 to 10 hour day. That tells me that I only can spend 5 or 10 minutes with each patient.
Wow.
So I'm not going to give you the proper time.
That's sad. That's a sad state of affairs here, but there's something we need to be aware of. I mean,
That's right. That's right. And that's why you ask questions.
Yeah.
If he says, I don't have time to go over it with you, then you say, I have to find me a new primary.
Exactly. Wow. I did have one question. You mentioned, like, staying out the fast foods and having the vegetables or fruit in your diet. And there's a supplement, kind of like an energy drink or replenish drink for when you work out real hard. Really, you really need stuff like in the summer, when you're sweating a lot. But it was saying that I think it had testosterone in it. Now they were saying testosterone could bring the prostate cancer back. Is that accurate?
Testosterone doesn't bring it back. Testosterone gives you strength.
Okay.
That's what it does. Testosterone, you see that right now with the Big Hurt and Doug Flutie.
Mm-hmm. Right, that commercial.
They
right.
do it all the time, and they tell you to get nutrigenics.
Mm-hmm.
And this here gives you back your strength, and it helps your sex.
And she'll love it too, right?
Right. All right. Right. That's a supplement that will cause you to. It has some of the ingredients in it that Viagra and Cialis have in it.
Okay.
So it gives you
no big deal.
Yeah, it's a stimulant.
Right.
That's what it is.
Right. But the testosterone is not going to bring back the cancer. That's what they were saying.
Testosterone is not going to bring back the cancer. Sometimes you need the testosterone just to have your body strength.
But
bring cancer.
But
it's not a.
But let me ask this, Patrick. Now when I went to when I started the treatment, in fact, my brother-in-law's too, they gave you something, the pill to kill the testosterone, because they say back in the day they used to
not to kill it, to decrease it. Your body produces the testosterone, and your body might have been producing too much testosterone.
Oh, really?
Right. That can happen. So then to decrease it to the normal levels, it's why you took another tablet, so that you don't produce more than you need. Okay.
Well, that's not what they said. They said they told me and my brother-in-laws who iron, well, they iron, but wasn't Buffalo, wasn't Houston, but they said it's the testosterone. They told all three of us, not the same doctor, but they said testosterone, you got to take the tablet because the testosterone will bring back the cancer. And I'm like, and that's why, and I asked another doctor about it, and he wouldn't answer me. I tell you, he wouldn't answer. Because I guess because they all know each other. He wouldn't answer. He just said, well, blah, 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 take a supplement, whatever, And he just said, make sure it don't have testosterone. I said, what? But now you telling me that's kind of like BS. I just, testosterone. Now, the testosterone levels. The only thing I know about the testosterone is like, well, I don't mow the lawn. When I mowed the lawn after that, decent. I was wiped out. I feel like I went, with Mike Tyson. I was wiped out. Like I played a whole football game, So of course I don't mow the lawn anymore. But I notice certain times if I, like try to move something like that, you might get winded, but
right.
But I'm glad you told me that because because I think there's a drink called Celsius.
Yeah,
it's supposed to, and so I'm gonna drink it.
Right, and it keeps you at a normal level.
Yeah, because we start riding, riding some, I want to start going a little further distance than I've been going,
Yeah.
and you don't want to get, tap out. So I'm glad you said that. Okay, so that's not really accurate saying testosterone brings it back from what you're telling me.
Right.
Forget about it.
Yeah, I'm not gonna say testosterone brings back cancer.
Appreciate it.
When you look at that and be honest about it,
mm-hmm.
Your body produces testosterone. So if it's gonna bring back your cancer, then we all in trouble, aren't we? As men.
Okay. Yeah. Well, that's what they said. I'm just saying that's what they told us.
I know.
And I wish one of them would get on now, but we're gonna post this so they could hear it because they need to hear it too. Because we just there's certain things. I didn't mind mowing the lawn, but once that happened, I'm like, phew. forget about it. I
Yeah.
ain't trying
No,
to do that.
no.
You know.
You're not going to have an overabundance level of testosterone that's going to hurt you.
Okay.
That's what they're looking at.
Okay. Okay. Yeah, not at this age, because I don't even when I ride, I don't ride like I used to. I will start
Yeah,
back.
yeah.
It's like being, it's just good cardio.
But if you think about it again, the big hurt is telling you to take it because of the fact they brought back his strength and everything. And he's an athlete.
Right. That's right. Right.
So if that was going to bring back cancer or ignite his cancer, do you think that they would be putting it in the market?
That's one way to look at it. But another way to look at it is they don't care. I mean, people who manufacture it don't care. But I understand what you're saying.
Right. No, I understand. That's why I said it's a lot of things that you really have to look at and really get the understanding of what is it doing.
Okay. Okay. And I really appreciate that. Pat, you got anything else you wanted to ask?
Ooh. No, I think I'm got a lot of good information.
Yeah. Well, especially, but I feel validated about the diet because my wife asked me because I have a banana, pineapple, blueberries, yogurt, and another piece of fruit every day. I mean, every day. Even when we go out of town. I mean, we went out. Even we go out. We're not the country. I had the same thing, and before she left town, I was eating. I went like about 2 weeks to salads. So I mean, I might put some tuna on it or something like that. Salads. That was it.
It's fine. That's good.
That's it. So at least that validates.
Well, I spent a lifetime doing everything in moderation.
That's good. That's a good thing. You moderate.
Yeah, I mean, when I feel like having something, I'll have it, But for the most part, I know I should know after all this time, stay away from certain things, But I do like certain things and I will treat myself along the way.
Well, we all do.
I did have a question.
Go ahead, Wesley.
Yeah, I had colonoscopy maybe 3 years ago. Everything was fine. But I was online and I just ran across this little survey. The survey said you take the survey and it'll tell you if you had an enlarged prostate.
Okay.
So I took the survey and it said you met and when they gave me the results, it said my prostate may be enlarged. So took that information to my doctor and he prescribed this medicine, tamsulosin.
Yep.
So I've been taking that for a while.
I got prescribed the same thing.
Really?
Yep.
Yeah.
Tamsulosin, all it does is it causes you not to go to the bathroom as much.
Okay, so that's basically all it does.
That's all it's going to do.
That's all it does.
Keep you from going to the bathroom as much. So the frequency that you would have is down. And because like I said earlier, enlarged prostate is common in African American men.
So
based on what we do.
What are the side effects if you're taking Thompson?
It's not really any side effects.
No.
It's just cutting down your urine, your frequency.
Well, it doesn't seem like it's really cut it down.
Really?
No.
It seems like it's
Well,
similar.
and again,
the
the
same?
thing with that is that if you do take in a lot of fluids, you're gonna still continue to go as much because, as I said, your bladder pushes up against your prostate. So an enlarged prostate is pushing back on the bladder. And that's what's causing you to want to go to the bathroom. So in order to keep your bladder from filling as much, you drink less fluids.
Okay.
What about, like if your stream, like, is a little, like early in the morning, it's like I gotta kind of wait a little bit and come back a couple of times.
That's one of the symptoms of prostate cancer.
What? Oh wow.
Yep. That's one of the symptoms.
Oh wow.
Because remember, when you were young, you were able to write your name in the snow when you
That's
go
true.
out there.
Right.
And you can urinate across the street.
You're right.
Now, as you get older and prostate starts getting enlarged, it stops.
Okay.
So streaming, if you got any type of sensation when you're trying to urinate, or if it's coming out very slow, that's a sign that you can be developing prostate cancer.
Oh
Now,
wow.
does it fluctuate? Because sometimes the flow is normal and
Yes, it does fluctuate because the abnormality in the prostate, it depends on where it's located. It depends on what quadrant it's in. Depends on if it shifts.
so it doesn't matter if your PSA and it says everything's everything.
That's my point. That's why I said PSA is not an indicator. PSA is a monitor.
Ah.
So your
The
PSA,
difference.
because your PSA is 3.0 or 4.0, does not indicate that you don't have prostate cancer or that you do have prostate cancer. It indicates
Wow.
that your specific antigen, your prostate specific antigen, is not elevated at that point.
Okay.
However, you can have prostate cancer because you can have abnormal cells that are in your prostate that has not grown yet to cause your PSA level to be increased. But they
Wow.
can be pressing against a quadrant that causes your urine to not stream properly, gives you pain, gives you a little bit of pain when it comes out, or if you see any blood when it comes out. Those are signs.
So what do you do if you notice? I mean, how do you go about, you go to your doctor and
You say, I would like to have an
do,
MRI
do the
of my prostate.
MRI like you said?
Yes.
I would
Yes.
like to have an MRI of my
That's what I
prostate.
should have did. Right. Right.
Okay,
Get,
so
get the MRI. Both of y'all.
yeah,
Get the MRI. Yeah. Get the MRI.
The MRI takes a picture of your prostate. And you have to remember, your prostate is walnut size. So it's about like that.
Okay.
That's all it is.
Okay.
It's walnut size. And as it enlarges, it does this.
Oh wow.
Normally, it's like that. When it does this, your bladder sits here.
Okay.
So it presses against the bladder. Your rectum sits here.
Right. Right.
So your prostate starts getting enlarged because it's trying to move and it doesn't have the place to go. So it gets enlarged, it comes larger, and that's why they say we have an enlarged prostate. A lot of studies are going on right now to look at it because of African American men love to drink.
Yeah.
All right. Well, the drinking affects the prostate. I mean, it affects the bladder.
Right.
And if the bladder starts swelling and getting bigger, the prostate has to do what? Move with it. That's what they say. It's part of the reason why we have enlarged prostates.
So I had a colonoscopy about, I don't know, month and a half ago. And do they notice anything about the prostate up against the
Colonoscopy and
colon when
prostate
they do?
there's no comparison for the colonoscopy or the prostate. They're in two different areas.
Oh, okay.
And
Well, you
that's
did say
where
it presses up against the colon.
no bladder and the rectum.
Oh, the rectum. Oh, yeah. Okay.
Problem is that's why I again, and that's a perfect segment right there. What he just did. That's why again I say it takes knowledge. African American men always, when you ask them anything related to prostate cancer, the first thing they say is, I had a colonoscopy. They say that all the time. I had a colonoscopy. It has nothing to do with the prostate.
Right. Right.
All right. But they use that. I had a colonoscopy and therefore I'm good.
Right.
But you're not.
Mm-hmm.
They're
Because the
not.
two aren't related.
They're not related.
Yeah.
Polyps in the colon, and the colon affects the rectum.
Mm-hmm.
Prostate does not. Prostate affects your penis.
Mm-hmm.
So you got to think of it. It's different.
Sure.
And then when you do that and you say you skip over what you really have when you accept that the colonoscopy told you everything you needed to know about your prostate. And that's why one of the things we do, we go out and we give the information as to it's not related. Don't
Good.
think about it. Don't think about it.
So in the instances that that Wesley and Patrick mentioned, the best, I mean, as a suggestion, they probably should need to get an MRI to know
I
what's
would get
going
an
on.
MRI.
Okay.
Before I do anything else, I will go to my urologist, say, will you do an MRI on my prostate?
Mm-hmm.
So we can see if there's anything there. You could have any abnormalities growing. You can see them in the MRI because there'll be dark spots that shows up. And then therefore you can say this is at this, he'll tell you at the apex, you have something looks very different at the apex. Or on the lateral side, you might have something that doesn't look right.
Mm-hmm.
These things can be seen with the MRI. You're not going to feel them. You're going to feel the abnormality. Because if I had a model, I can bring a model and let you guys feel a model of the prostate, and you can rub it with your finger.
Wow.
And you'll see exactly what we feel with when you do a DRE.
Mm-hmm.
You feel it. You can feel the elevations in the prostate. You can feel the dips. That's why it's the best that's out there right now. That's the best screening tool it is to feel it, because you can feel the differences. Whereas the PSA is not going to tell you that.
Okay.
And that's how you get to do it.
So you think that like men of our age, it should only, as a preventative is to get an MRI. It should be like sort of mandatory thing to get an MRI
It's
at
not going
this
to be
age.
mandatory. I wouldn't say it's mandatory. I would say that you're going to get an MRI if you are suspecting that there's anything wrong.
Right.
But if you get
But even preventative.
if you get a yearly DRE, it's going to indicate or tell you at that point, yep, we did the DRE, we better do an MRI. But if you do a PSA, I'm not going to tell you to do an MRI.
Because I'll go see my doctor.
I'm going to tell you that, oh, your PSA levels are okay, or your PSA levels are not elevated, or your PSA levels are elevated. They're elevated, let's get a biopsy, or your PSA levels are doing this or doing that. That's not telling me that could be telling me anything. Your PSA,
Right.
like I said, you could have sex with your wife last night and go get a PSA today, and your PSA level is going to be 14. Should you?
Okay.
Does that mean that you got cancer?
Okay.
You're saying that we kind of been lulled to sleep by the PSA.
You got that right, and that's exactly what's been happening. And I was on that team. I'm just telling you, I know that was when the PSA came out. It was very good because it was the first thing that ever came out that gave you some indication that something was happening in the prostate.
Okay.
The specific prostate antigens were increasing, and if they increased, it meant that something was happening.
Okay.
That's what that was for. And so, yeah, it's that, well, it's related to, sure, your antigens will increase if you develop cancer. That's true.
Okay.
So that's why the PSA came about. Now, is it saying you have cancer? Well, when all of this study was being done, you never looked at the things that was causing the PSA to elevate.
Right.
You only looked at the fact that, yes, it will elevate if cancer was involved. That caused for you to produce that tool for a screening tool. But now when you start looking at it down the road and you find out that, oh, this causes the PSA to elevate, this causes it to elevate, this causes it to elevate. Well, these things got to be known prior to doing this PSA test.
Mm-hmm. Okay.
So that's why I say to you, yes, if you know that you're going to go get a PSA done, don't do anything for 72 hours.
Okay.
And that's going to give you your accurate PSA reading.
But the abnormalities, like you said, when you're urinating, with the fluctuations in the stream, things like that, those are signs
That's
that
signs. And that's why you go get an
something's
MRI.
going on. Something's going on. Okay.
Right. That's why you get an MRI.
Yeah, that's some fantastic information. I mean, that's man, we gotta get everybody I know to listen to this podcast, because that's critical. That's critical right there. Man, that's fantastic. Okay, so gentlemen, you have any other questions for Dr. Sumner? I take that as a no, but I really appreciate it, Dr. Sumner. Really appreciate your efforts, and I hope you continue that. Oh, before you go, how's it coming along with the testing the urine for?
I am right now at the getting at the FDA approval stage.
Okay.
So once the FDA gives us the clearance to approve that it can go into phase 1 trial, then we will be taking, right now, I am taking samples from men. So I get urine samples from patients right now, and we've done 45 or 50 patients where we got samples, which gives us the trial to say, yes, this is showing that we have these biomarkers in the urine that's related to prostate cancer and the stage of prostate cancer. So now we want to do synthesis on these to verify it and make it where we can put it into practice. And so now the FDA is looking at it to give us the permission to go ahead, put it into practice. We'll do the phase 1 trial. Once the phase 1 trial is done, then a patent will be done, and then it will be put out into market.
That's fantastic.
One off question, Dr. Sumlin. I
Yes, sir.
have a tax man in Buffalo named Adam Sumlin.
That's me.
That's you?
That's me.
He just all right.
You worked out there on Transit Road in the mall?
I did. And when the mall closed, I moved to one of my rental properties at 155 Newburgh.
Yeah, because you do the taxes for me and my wife, Daisy.
Yep.
Okay.
I said, oh, because I kept on thinking Sumlin. Because when I first saw you, you did I came up there to the mall, and you did
Yep.
my taxes for my.
And Daisy you guys are in New York.
Yeah.
Yep. And your daughter.
Right. Good memory. That's awesome.
Oh, okay. You never
Well,
told me he was a doctor.
Right. Well, you didn't
was
ask.
No, you didn't. You
That's
didn't.
right. That's right. That's right.
Matter of fact, you just came in and said, I want to get my taxes done. My wife is in New York. I'll give you the paperwork. Is it all right if you do them for us?
Yeah, I think you've been doing it for about 5 or 6 years.
About 6 years now.
Yeah.
Yep.
Awesome.
Yeah.
Awesome. All right. All right.
I
Welcome.
can't wait to tell her.
Okay.
Oh, okay. Yeah.
Okay.
You a man of many trades, huh?
It's all
Well,
good. It's all good.
it's all right. I did taxes to be honest, taxes came to me as for almost the same reason. I started doing taxes as not a hobby, but I was doing my father at the time. I was in school, and he knew that I liked math and science. And his tax person did his taxes, and he got a letter back from the IRS. And he sent it to me and said, what's going on here? Why do I have this change. So I looked it over in Nashville, and he was in Buffalo. I looked it over, and you had to do everything by hand. And so I said, you tell her she has to do an amendment because she left this out. He
Wow.
said, oh, okay. So he told her, and she told him, your son is right. Ask him if he do small time taxes for me. And I was like, nah, I'm not doing no taxes. I'm going on to school. I'm not doing it. So then I came back to Buffalo and just on a visit, and he said, I don't want her doing my taxes no more. I want you to do them. And I said, you know what? In order to do these, I might as well do it right. I went to H&R Block, took the course at H&R Block, and I was the only one in H&R Block doing corporate taxes. And I
Wow.
got mad with them because they were overcharging everybody that came in that door, especially Black.
Wow.
They were
Wow.
overcharging them. I mean, you would do a tax, and the tax would cost maybe $65 to do the tax, and they're charging $500.
Ah, that's crazy.
So I
That's
was like,
crazy.
forget this. So I told them, what literally happened, I was a supervisor at H&R Block, and it was another supervisor. So and they always told us, don't ask the client anything. Let the client tell you everything. So I'm sitting there, and next to me, the supervisor asked this white lady, and she was white. They came in, oh yeah, you went to my church, and I saw you give money. And didn't you borrow money? Didn't your brother borrow money from you? And didn't you do this? And didn't I'm like, oh, what is she doing? And she led her down the path of all her deductions. And I was like, okay. So then this Black lady came in, and I said, do you go to church? And she said, yes. And this lady come running into my office. You can't do that. What are you doing? You can't do that. I said, I have a client. Let me finish with the client and we'll talk. No, you can't. I said, no, we're gonna finish. I'm gonna finish with my client. I finished with the lady that I was doing. And then I went to her and I told her, I said, first of all, I didn't lead my client down the path. You did. I said, but I tell you what I can't do. She said, well, you can't do that. You can't. I said, no. She said, you can't do what I do. I said, no, wait, hold it.
Wow.
You're a supervisor and I'm a supervisor. I said, but you can't do what I do. I do all the corporate taxes in this office. You don't do not a one. I said, so you can't do what I do. I said, but I can tell you what I can't do. I can't work for H&R Block anymore, and I can't do these taxes. And she said, well, you can't take any of our clients. I said, I don't want your clients. I'm at the hospital. I don't need this job.
Yeah. This is extra for me.
Right. And she went on and said, well, we'll see. So I walked out and said, I'm done. Well, the president of H&R Block called me the next day and said, hey, we can't afford to let you go. We'll move you to another office. I said, no, you're not moving me anywhere. I don't need to do taxes. And he said, no, you do all of our corporate taxes. We don't have anybody to do that right now. I said, well, train her. I said, because I'm not doing them. So I left.
That's awesome.
And from that point, people that was at H&R Block that I did their taxes started coming and asking me would I do their taxes. And I was like, I don't work there anymore. And they said, no, we want you to do it on your own. And that's how I started the business. And I don't advertise.
Nice.
I don't talk about it.
Yeah, because I got word of mouth from someone about
exactly.
Yeah.
I have over 400 clients.
Ah, wow, fantastic.
Yeah,
fantastic. And that's just
we're very happy. We're very happy here.
I don't push it. Yeah, my passion is my prostate cancer.
All right.
That's my passion. Like I said, I've been at Roswell for 38 years.
Well, I would think your main thing is you just like to help people.
Oh, that's true. You're absolutely right about that.
Yeah.
True.
That's
so
fantastic.
That's why. So yes, I do you guys taxes.
All right.
Wow.
All right.
But,
yeah, thanks for the little segue, Patrick. Appreciate it.
All right.
But once again, we want to thank Sunship Communication. We want to thank you for your knowledge. This has been a very, very valuable presentation. In fact, Dr. Sumner, we might want to revisit it again because I know we're going to get some responses from once we post this. We'll be posting it at YouTube. Sunship Communications presents. It's Sunship Communications presents Express Yourself.
Okay.
On YouTube. and it should be up this week. But once we post this, I'm sure we're gonna get a lot of hits, and we probably maybe at least sometime in 25, hopefully, God willing, we'll be bringing you back. Thanks again. Really
No
appreciate
problem.
your
Any, you
time.
got my number.
Thanks again.
Dr. Summerlin,
Yes, sir.
it was a pleasure, very
Yes.
informative,
Very good.
Thank you. All right. Peace be with you. Thank you.
Peace. Thank you.
All right.
Bye.